Eric Wallis with us. He's the president for the Henry Ford West Bloomfield Hospital. Thank you for being with us.
Yeah, thank you guys for having me back.
We were just talking about the story about the tuition-free program that the state of Michigan has launched throughout this pandemic. Do you hope that that helps impact the healthcare industry?
No, absolutely. I think one of the things we've seen throughout the pandemic is that the workforce in Southeast Michigan specifically has been very tight. We need more folks to step into various careers, including bedside nurses who can go and start their career with a 2-year degree at their local community college. We have a lot of unlicensed roles, technical roles that we would love to see folks to step into and get some training and be able to come into the workforce. As simple as we need folks who are chefs and cooks and folks who work in our environmental services spaces, all of whom benefit from those kinds of programs. So very much being supportive of seeing those programs grow.
With that, Eric, too, I think that so many people, when they think of a hospital or a healthcare system, they think of it like needing an advanced degree. But there are so many jobs open to everyone. And once you get in, you can really create your future. Take advantage of the opportunity.
Yeah, absolutely. And I think, almost every hospital system has, programs that are designed to help people go back to school, to support their career growth. Just last week, I was talking with one of our environmental services team who's been in her role for a couple of years now. And now she's going to be stepping into a role with our valet team. We see all the time folks who start out in non-patient care roles who then step into things like nurse assistants, who then go back to school to become nurses. We see nurses who become nurse practitioners. And so it's really a series of lifelong learning opportunities where if you're somebody who's motivated, somebody who wants to grow and got a path that you're heading toward, that's exactly who we want. We want people that want to continue to do more, and we can support them through that process.
So with that, Eric, if I can ask you as well, because several years ago I had a girlfriend, she was 40, and she went back to college. She was an esthetician. She went back, got her nursing degree at 40 years old to become a nurse. Now she works at a local a local hospital. But so many people think once I reach a certain age, I can't do something. But the healthcare industry to me is jump in and learn.
Yeah, absolutely. We have folks from all kinds of different industries that jump in. We've got one of our nurse managers who started his life and spent a lot of his life on the line at Ford and decided he wanted to do something different. And so he came back and became a nurse, and now he's one of our nurse leaders. And so there's, lots of those kinds of stories that exist. And so you're never too old. What we really want is somebody who wants to serve people. And if you come kind of with that attitude, we can help you find your passion in life.
And with that, I know that you kind of started on the nursing side as well, but really talk about it doesn't matter what position you work at in a hospital, you are helping people.
You betcha. I think every single person in this building has one of two job descriptions. They either take care of patients or they take care of the people taking care of patients. And both are equally important. And so, yeah, there's no end to the things that you can do. And we've got just about every type of skill and trade and person here in our facility. And that's one of the great things about healthcare is there's such great diversity within the building and the different types of roles that you can have. And at the end of the day, every single one of them helps to make a difference in people's lives.
Eric Wallace with us here on the MegaCast. He's the president for the Henry Ford West Bloomfield Hospital. And if I can kind of take you down a memory path, do you remember your first day on the job?
Oh my gosh, yes. So I think you alluded to, I was a bedside nurse working in a medical surgical kind of unit. And, I could tell you horror stories about day one, but at the end of the day, we got through it. And, it was a character experience. But it was great. At the end of the day, I went home and I knew I made a difference for the people that I was taking care of. So, I joke all the time that, being a nurse is the greatest thing in the world. And if you're not careful, someday they'll make you the hospital president.
Well, you are definitely an example of where you can start out and where you can end as well. But just think about all the lives that you've touched through those years and through that journey. And if we can kind of talk a little bit more about COVID-19, the numbers are down in Michigan. I think the last time we had you on, we were in that middle of that crazy surge here in the state. A little bit of relief or not yet? Are you concerned about the variants?
No, it's been an interesting kind of surge. We saw this surge this latest surge go up very quickly, and it's actually come down very quickly. So it's not like the previous ones that we've seen. It was a very young population that we saw getting COVID-19 this time, and frankly, that means that we know that the vaccines work. And a lot of the folks that were coming into us were folks that hadn't been vaccinated yet. So it's been really good. We've been down in the low single digits now here at West Bloomfield. For a number of days of patients in the building. And actually what I'm most excited about is in kind of watching our testing of folks that have come to the emergency department. We haven't had anybody test positive now in several days.
Wow.
And so, it's a great thing to see. I'm very excited, and actually was having the conversation with folks earlier today. We're very fortunate to be here in Oakland County because Oakland County has one of the highest vaccination rates in the entire state. And I think we're seeing the benefit of that and the upside of that right now.
So with us right now on the MegaCast, Eric Wallis, president for the Henry Ford West Bloomfield Hospital, and such an important part that you just touched on. But with that, a little bit of hope, especially when we go into the summer months, because last year is any indication, the numbers typically go down in the summertime as well as more people get outdoors. But are you concerned about the variants and people being so relaxed that they feel like COVID is over?
I think it's an interesting question. I think certainly we need to be concerned about the variants and probably not so much the ones that have come to the scene thus far. We know right now that the Pfizer vaccine, the Moderna vaccine, the J&J vaccine are very effective against the current batch of variants. I think what we have to worry about is the next one that comes. But as long as we haven't reached that high level of folks being vaccinated or quote unquote herd immunity, there is still that opportunity the virus is going to continue to mutate. And we're all hopeful that we don't get to a place where we find a variant that the vaccines aren't effective against. But it's like a lot of other things. If we don't get to a high enough level of vaccination quick enough, it will happen. And so I think that is the worry that we have.
Yeah, and if I can ask you about that, because I do feel individuals such as yourself, you're so much smarter than me and so many of the other members of the general public because of your science background. And we are seeing this vaccination really kind of hesitancy here in the state of Michigan. And if we were to go by the governor's original goal of trying to reach 70%, we're not near there. It's like we are hovering. What do you think it's going to take to get us to that herd immunity?
Well, it's going to get there one of two ways. It's going to get there by vaccination, or it's going to get there by people who have been infected. And so I think that the combination of the two of those things is going to get us to herd immunity. It's just a matter of how long that's going to take. We know when you just look at the number of cases that we've had in the state of Michigan, that a significant portion of the population has been sick or has recovered from COVID-19, and those folks have some level of protection. What we don't know yet is how long does that level of protection last. And you'll see a different story every other day about how long and are we going to need boosters and those kind of things. The reality is that the studies that are being done by Pfizer and Moderna are 2-year studies. And so they're continuing to follow folks that were in that trial phase of their vaccine studies. And what we know at this point is you're protected for at least 6 months. And they're going to keep checking those folks and see how long the protection lasts. So it is possible that it's only going to last 6, 9, 12 months. It's possible it could last multiple years. We just don't know yet. And that's part of the ongoing science that we're going to have to wait for.
Eric Wallis with us here on the MegaCast. He's the president for Henry Ford West Bloomfield Hospital. And if I can ask you about that too, because it is a novel virus. This is new. We're learning as we're going. But just as you said, we don't know. And I will say I had a family member that was positive for COVID-19, lucky enough to be mild symptoms months ago, and then was exposed again, went and had the test, and didn't have any antibodies. And you're looking at a few months. So when you're saying this too, we don't know. So how much do you think that's hurt the confidence from the general public in our healthcare industry?
Yeah, I think it's interesting just because we are in a society today where we put out a lot of information and there's a lot of transparency. And I think sometimes people believe that because we put out what we know today, that it is fact. And so I think your point is a really important one. This is an evolving science. It's a virus we've never seen before. And so, unlike the flu, unlike polio, unlike some of these other things that have been around for eons, this is something we're going to continue to learn about for a number of years. We do know there are studies that have shown now that people who have gotten COVID-19 are still benefit from getting the vaccination. In fact, when you've had COVID-19 and you get the vaccination, you're actually much better protected than even those of us who just have been vaccinated. And so it's kind of a super response that your body has to it. And so it's important for those folks to get vaccinated too. And that's been an evolving understanding as well. So I know people get frustrated with wait, you used to tell us to do this and now you're telling us to do that. But the reality is we're trying to be very transparent and tell you what you know as we learn it.
And I love that you just brought up the point, people who've had COVID, it's just as important for you to get vaccinated as well, because I do think there's been some conversation in the political arena. Well, if you've had COVID, then you have the antibodies, you don't need the vaccination, and that may be contributing to the lower numbers of vaccination within the country as well. And but with that as well, can I just ask you, looking back over the past year, have you ever seen a situation where vaccination has been so politicized?
No, and certainly that's one of the more unfortunate things in this is that the science is not political. It shouldn't be political, unfortunately. It is what it is, and I think that if we can all take a step back, and I tell family members and team members alike, just turn off the news. Certainly not Civic Center TV, but turn off the news. Listen to reputable sources. Go to folks when you hear something that doesn't make sense. You got a lot of great resources that are out there. I'm biased. You can go to henryford.com and get all kinds of factual information. But unfortunately, I think we live in a world where too many people don't take a few seconds to actually check what they're hearing. And it spreads like wildfire. And unfortunately, a lot of well-meaning folks have spread things that aren't necessarily true because they haven't taken the time to do the fact checking on it.
Yeah, and we should point out too, we always put the direct links to so many other resources right on our page as well, because go ahead and take time. Go to the actual direct information. Don't rely on social media or even your local news to try to give you that information, because we know so many times they're limited in the time into which they can give that. But I will say, I had a conversation with a family member, and when the conversation comes up about vaccines, I was like, well, we went to Africa a few years ago. I had to get so many vaccines. I was like, I remember the tray, like 8 needles laying there. And those were required to be able to travel, just like we're seeing now. And all the side effects that we're talking about now with the vaccine. And then also with the J&J, the conversation around the blood clots. And I said, well, for women, so many of us are used to that conversation around taking birth control. So this is not a new conversation.
It's really not. And I think that's what's really so frustrating sometimes for folks that are in the medical field. We've effectively wiped things like measles and polio and smallpox off the face of the planet because of vaccinations. And this is really no different. I continue to stress to folks that, people worry that this is a new vaccine. This technology has been around for over 20 years. We've been treating cancer patients with mRNA technology for over 20 years. The scientists that developed the vaccine started over a decade ago. And so, yes, it's the first time that we've used mRNA in a vaccine, But I think really as you go forward, you're going to see things like the flu vaccine convert to mRNA because we've learned that it is so safe and it is so effective. I'm excited, as just coming out the other side of this, that we actually have a potential to eliminate flu. If we have the same kind of success with that vaccine as we do with the COVID vaccine. And so I just continue to stress to folks, follow the science. People are doing their very best to put out the right information, but it's a great vaccine. They're very safe and they're very effective.
Eric Wallis with us here on the MegaCast, president for the Henry Ford West Bloomfield Hospital. I'm happy to hear you kind of mention the flu as well, because I feel like we haven't been talking about the flu, but we should understand so many people do die from the flu each and every year. And even when they do die, it doesn't make headlines. So this could save lives on so many different fronts. Eric, before we let you go, just another minute or two with you. At the hospitals, are restrictions starting to ease a little bit regarding visitors?
You betcha. Actually, one of the great things that we've been able to do here at Henry Ford West Bloomfield is we've actually removed all of the restrictions around visitation. Save, you still have to be screened when you come in the building, and you still have to wear a mask when you're in the building. But patients can now have, multiple visitors. We know that the best thing for our patients is to have their loved ones with them. And so we've really loosened those restrictions. Every hospital is going to be a little bit different based on their circumstances. And so I encourage you to go out to, if you're going to visit a loved one, check the hospital website first. It'll give you a good indication of what's allowed and what's not. But right now here at Henry Ford West Bloomfield, we're back open to, visitation 24 hours a day. We do have restrictions on the entrances to the building, but, people can have their loved ones with us. Really, the only thing that's kind of a restriction at this point is if the patient is COVID positive, then we're limiting visitation with those patients. But there's only 4 of them in the building today, so it's great news.
That must make you feel happy, because what a year you and your staff have been through the past year.
Yeah, it's fantastic. I mean, you can see the relief in folks' faces. You see a lot more. Well, we see a lot more smiles in people's eyes right now, I'll say, but. We know every step is one step closer to getting back to normal, and we're back to the place where we do have some activities going on within the building. We're not quite back yet to where we're able to have folks come just visit us for lunch, but that day's coming. So and I think all of those steps are what we need as human beings to get back to normal and to feel like the world is returned to the one we knew.
Fingers crossed. We are definitely on the back end of this pandemic. Eric Wallis with us, President Henry Ford West Bloomfield Hospital. You and your team have been amazing throughout this entire pandemic. It's been a roller coaster ride.
Yeah, it's we have a lot of folks who have kind of gone through things, the same kind of stresses that you see with folks who are coming back from the military. There's a lot of PTSD that's happened in healthcare. As a result of this, and we put a lot of resources in place to support our team. But I think we're kind of at that point now where that light at the end of the tunnel really is a light at the end of the tunnel and not another train coming. And so that you can see the joy coming back to folks and the work that they get to do. So we're very thankful for that.
Well, let's hope so. And we do know that it's been an extremely stressful time for those that have been on the front lines each and every day. But let's hope that with some of the new programs and also the attention that COVID-19 has put on the healthcare system, that we have more people that want to go in and help save lives and make a difference. So thank you so much for your time. We always appreciate it.
Absolutely. Thank you, guys.